today's webinar on COVID-19, vaccination for children of 15 to 18 years. I am Shreen Sharma.
And I am Lavanya, and we will be moderating today's event. This session is being held for the parents and students of classes 9 to 12. The webinar is being organized in consonance with the vaccination drive launched by the Government of India. Given the trend of increasing COVID cases, it is of utmost importance to get children vaccinated as soon as the chance is made available. It is necessary to get vaccinated to lessen the severity of the disease and reduce the risk of hospitalization and potential fatality.
Today, we have with us a diverse panel of individuals, including doctors, health experts, and parents of students who have already been vaccinated, to talk about the importance of getting children vaccinated and the experience after.
So without further ado, let's begin with introducing our esteemed panelists. Our first panelist is Dr. Sanghamitra Ray. She has an MBBS MD in Pediatrics and is a gold medalist from Lady Hardinge Medical College and Kalavati Saran Children's Hospital. She is an assistant professor in Pediatrics and is in charge at Thalassemia Daycare Center and in charge at Pediatric Hematology Division at Chacha Nehru Bal Chikitsalaya, Geeta Colony, Delhi. We welcome you, ma'am.
We also have with us Dr. Risham Garg. He holds a Doctor of Laws degree for his work on international contracts and the UNCISD Convention. He is currently working on Associate Professor of Law and Research Director, Center for Transnational Commerce Law. We welcome you, sir.
We would also like to introduce Ms. Nidhi Tyagi, a revered member of the Parent Teacher Association of Queens Valley School. She works as a business developer at IKEA. Thank you for joining us today, ma'am.
Our next panelist is Dr. Nitya Khare, an alumna of QVS. She has an MBBS from Lala Lajpat Rai Memorial Government College, Merit. Dr. Khare has also been a part of COVID vaccination launch team, which included the first trial of the vaccine. We welcome you, ma'am.
We take great pleasure in introducing Dr. Kritika Chaturvedi, who is also an alumna of QVS. She is an MBBS graduate from SSMC, Rewa, Madhya Pradesh, and is currently working as a medical officer in CHC Gur, District Rewa. Thank you for joining us today, ma'am. We would like to thank all our esteemed panelists for sparing their time and joining us here today.
I will now run you through the set of instructions for the day. All attendees should know that they will remain muted during the session. Please drop your questions for the panelists in the meeting chat. All questions will be addressed in the question answer session. You may raise your hand as a request to unmute yourself in the question answer session.
Let us now begin with the panel discussion.
So, Dr. Sanghamitra Ray, since you've been involved in the field of pediatrics for so long and also have a lot of experience as a medical professional, I would like to direct the first question to you. I would like to ask if specifically for children aged 15 to 18, are there any evident effects or side effects that we might face after our first jab?
Okay, first of all, I'm delighted to be a part of this webinar. As we have started almost at the start of 2020, maybe we have started seeing this COVID infection. What is COVID? Is SARS coronavirus 2 infection. And rapidly we have seen 2 waves of this COVID-19. But during this time, as a pediatrician, I would say that we have seen very negligible number of children who were very seriously ill. And apart in contrast with the adult that we have seen so severe infections and pneumonias, they were ventilated. But in children, it's not, I will not say we have not seen. Yes, we have seen very sick patients that we'll discuss later on. But the frequency of the children being affected with a serious disease is very less. So coming to your question that should they be vaccinated if they are not having very serious infections, or what are the side effects? So I like to tell you that for any immunization, any vaccination that you have received till date, till you are 15 years of age, you have received many vaccines, and there are some or other side effects are there, but they are negligible when we compare the benefit of the vaccine. Similarly with the COVID-19 vaccine, and as the studies show, there has been phase 2 and phase 3 trials of the vaccines. They have seen that the side effects are very minor kind of. Yes, severe side effects can occur with any vaccine, but it's very negligible. severe anaphylactic reaction can occur with any vaccine. Similar with the COVID vaccine, it's not very high. And till now, I think today I don't know the exact number, but till yesterday, we have already vaccinated 84 lakhs of children, this 15 to 18 age group, since we have started from 3rd of January, and the results are very encouraging. We have not seen very serious side effects, so we are not expecting much.
Thank you, ma'am.
Thank you so much for that valuable insight, ma'am. You were talking about children getting regular immunizations and vaccines as well. So I would like to direct my next question about the same to Dr. Nitya Khare. Ma'am, is it fine if children go for getting the COVID-19 vaccination along with their regular annual immunizations, or is there a separate procedure that is to be followed when it comes to those immunizations?
It's actually totally fine, but we have to wait for 14 days around to get the other vaccine. Like if you have some vaccine and you now have to get COVID vaccine, you have to wait around 14 days. There is no such as interaction have been found till now, but at least 14 days gap should be taken.
All right, ma'am. Thank you so much for that valuable insight. Now, before we proceed further, I would also like to welcome our principal, Dr. Namita Sharma. Ma'am, thank you so much for joining us today. I would like to request you to address us all with your enlightening words.
Good afternoon, everybody. I'm so sorry. I am out somewhere and the connections are very, very poor. But it's such a pleasure to see all the faces which are so important to us today here at this platform. Thank you, parents. Thank you, alumni. It's so heartening, and we are feeling so proud to have not just our parents, esteemed parents, but also our two alumni who are doctors. Other than the parents, see, when you have your own children at such positions, it's always so great. And I really hope that we are able to touch our children, though I know that we are all aware, and it was an eagerly awaited decision by the government. We all wanted that our children are safe. We have been saying till date that children come to school, we are safe. I mean, because we are not going to contaminate you as teachers or maybe as parents. But now if our children also get the same, and I really hope that today we are able to touch them and motivate them that each one of the queen is vaccinated and as safe as anybody else, because your safety is the priority for us parents. And I think all our parents would agree to that the safety of our children is most important, because we would like them to come to school, but again, under all safe circumstances, how much ever we follow the protocols, whatever. But if our queens are safe, I really hope that the country also would become safe. And very soon, I hope that the vaccination comes for the next lot of our children also. Over to you, Lavanya. Thank you, beta. And I hope that we are able to convince all our girls. I don't think we need to convince them. I think they are all ready. I have one parent here. I know she's from our parent association, that her daughter was supposed to get the vaccination today. Yes, ma'am? Nidhi, ma'am?
Yes, ma'am. Gauri got vaccinated yesterday. Actually, we rescheduled the time and we wanted it to be quick. So we vaccinated, she got vaccinated yesterday only.
She's all good? All safe?
Yeah. All safe and sound, no problem at all.
Wonderful, wonderful. So it means it's all safe for everybody.
Absolutely, no doubts.
Over to you, Lavanya. Thank you, beta.
Thank you so much, ma'am, for your enlightening words. So now we would like to resume the panel discussion. Our next question goes to Nidhi Tyagi, ma'am. Ma'am, as the proud parent of a child that has already been vaccinated, are the vaccination centers particularly crowded during certain days and hours? And what is the procedure that is to be followed when it comes to getting your child vaccinated?
So let me start with the procedure. It's as simple as possible. So we need to register ourselves on the COVID app. You can use your school ID for age certification, your Aadhaar, documents which have a date of birth. So that can be used to register yourself, and then of course you get the slot, time, and the vaccination center. Then it's just you need to go over there, and I think it hardly took us 20 to 25 minutes for Gauri to get vaccinated. And when it comes to the crowd part, See, yesterday it was very less of the crowd because we took the, first of all, it was a working day. Second, we took the slot which was like 9 a.m. or 10 a.m. So, of course, people were rushing to the office rather than to the center. But I assume that the crowds can be more during weekends because most of the parents are free from their daily jobs. So, weekends could be crowded. But otherwise, it was a very smooth flow of the vaccination process.
Right, ma'am. Thank you so much for enlightening words. I'm glad to know that the vaccination procedure is actually smooth and efficient. And talking about students getting vaccinated, I would like to direct my next question to Dr. Risham Garg. Sir, as an individual who has had a lot of experience in dealing with students, what are the efforts that teachers can make in order to let their students know the importance of getting vaccinated? And how can teachers contribute to the cause of their students getting the jab?
Thank you for the interesting observation and the question. So I certainly thank Queens Valley School for inviting me to this very welcome and the timely webinar, this very topical issue. And certainly vaccination for children below 18 years was very, very, eagerly awaited. And as we have heard from the doctors and from the proud parent of the vaccinated girl, that we are seeing, a good encouraging response from the students in registering and also getting vaccinated. So the first thing, we in a university, we are also having initially the teenagers, so 18 years, 19 years kids, students are there. And first of all, I can see that, they are quite well informed. So they keep them abreast with the information. However, the minor issue is about there is a lot of misinformation and disinformation. However, we try to ensure that we are following the guidelines. So the Delhi Disaster Management Authority provides those guidelines. There is a protocol, and that protocol has to be implemented in the institution. So we now there is a graded response plan, GRAP, and the Delhi Disaster Management Authority regulations. We are, notifying to the students. We are communicating with the students. There are several discussions with them, and there are different ways, in which we are able to communicate with them. So the first challenge is to get the correct information there and try to dispel all the misinformation and disinformation which may be there in the mind, because we are all in the internet age. There are all information technology devices. The last 2 years, you're all on the computers, laptops, tabs for your education. So that has, given a lot of sense of maturity to the students. So I have seen initially when we faced this issue, there were some issues, but I think now, and I'm happy to say that the students are, really presenting themselves in a very mature and a systematic manner. So yes, we follow the relevant DDMA guidelines, and we try to ensure that the correct information is provided, and we also try to dispel the misinformation and disinformations.
Thank you so much, sir, for your invaluable insight. I would now like to ask the next question to Dr. Kritika Chaturvedi. What if I had already contracted COVID-19 and recovered? Am I protected by natural immunity, or do I need to get vaccinated again?
First of all, I would like to thank everybody for welcoming me here. It is a great honor. And as far as your natural immunity is, even if you have already contacted COVID-19 in the past, you are supposed to get vaccinated again as per the latest government guidelines. And it is said that natural immunity is beneficial, but not as much as how much the vaccine would help you out. So right now, the government suggests that you should get vaccinated, and even the health officials are suggesting you to get vaccinated, even if you have contacted COVID-19 in the past.
So just want to add one thing that yes, after infection we do get antibodies, but sometimes they are not protective antibodies. Like an example I can share with you is that of dengue. In dengue we get antibodies against one serotype. Then you can get infected with other serotype, and in that scenario you can have a more severe infection because your body reacts with that enhancing antibodies. That is called enhancing antibodies. So those antibodies are not protective. So similarly, we don't know because last I think December 2019 we have seen the first case of this SARS-CoV-2, and since then that time has been just 2 years. So we don't know exactly how much this natural immunity is protective and how much does it last. So it is advisable. There is no doubt about it that you have to take vaccine even if you are infected with COVID-19. Obviously, after a gap of at least 2 to 4 weeks, roughly 4 weeks, 4 to 6 weeks.
Otherwise, also, like some of us must be knowing that we have been impacted by COVID or we have had COVID, but many of us would not have even known because we must have been asymptomatic. So asymptomatic or not, it is always good to go for the vaccination process at every age. We start our vaccination process very early in age. The moment we are born, BCG and then one vaccine and then another. So what's the harm in getting this one? Every day a new mutation is coming up. So why don't we equip our body and become warriors?
Thank you so much.
Very rightly said, Sangamitra. So I hope that now nobody would have this doubt. Even if I've had COVID, I am going to go for the vaccination. Yes?
Thank you so much to our panelists for wonderfully addressing the question. I would like to direct my next question to Dr. Nitya Khare. Ma'am, as someone who has been a part of the COVID vaccination trial team since its launch, I would want to ask you, what are the necessary medical precautions that children should take before and after getting the vaccination? And is it fine if people with certain allergies get the COVID-19 vaccine as well?
Okay. So if you're talking about firstly allergies, we have to see, you have to concern your doctor that which medications you are allergic to. And if you have a severe allergic reaction during the first jab, then you don't have to get second dose. No allergies, you have to discuss with your practitioner. Then what necessary precautions we have to take? Some people, what they do is that they take the paracetamol before getting the jab done. So you have to avoid that. You might take it after getting vaccinated if the symptoms are there, some side effects are there, but not before that, because studies have actually not clearly shown that if paracetamol would have some alteration with the vaccine efficiency. So better avoid that. And secondly, when you get vaccinated, you have to at least wait for half an hour there at the COVID vaccination center to see if some anaphylactic reactions, which are very rare, if they occur or not, such that medical practitioner could take care of it then and then only. So that's it. There's nothing to worry about.
Right, ma'am. Thank you so much. Now that we've addressed the medical precautions, I would like to ask Ms. Nidhi Tyagi as to what can parents do to prepare their children mentally for getting the COVID-19 vaccination? Is there any particular steps that they should take? Is there a particular procedure they could go about? How can one prepare their children for getting the COVID-19 vaccination?
I think what parents can do is apart from, there is nothing as particularly any steps that needs to follow. But of course, they can still motivate their kids to go for a jab, because I believe this in teenage sometimes, since you all are so well informed, there can be a difference in the opinion. So I think there are two aspects to it. One is the medical benefit, of course. Then there is a social benefit. And the social benefit, if I can say 1, 2, 3. So the first one is you will be able to meet your friends going forward. So that is one of the best social benefit you can get out of it.
Fun.
And then, of course, the outings in the mall or the birthday celebrations and all these things, that's the second best thing you will ever get once you are vaccinated, because then parents will not be worried sending you out. Then they are at least...
but it doesn't mean, ma'am, but you need to put this tagline that it doesn't mean that you can remove your mask.
No, not at all. That
Yes.
that is going to be part of any social visit so far, and also in the future. So when it comes to the family as such, once you are vaccinated, then it's safe for the family members also. So like we are vaccinated, we feel that the environment is safe. Once you all are also vaccinated, then the whole family is quite safe. And then we have elderly people also in house. So it's a kind of a protection that you're giving to the family altogether.
Thank you so much, Nidhi ma'am. In the same fashion, I would like to ask Dr. Risham Garg a question. In the context of social visits or even gatherings, with the exam session approaching, how would getting the vaccination prior to the commencement of in-school classes and examinations help the children individually and the community as a whole?
Yes, certainly. This is a very, very pertinent topic. I'm sure the government must be thinking that, the board exams are coming and now we are going to have the sitting exams. And now it's imperative that the kids must be vaccinated. And, I found that it is quite, it's exciting as well. My daughter, my 17 years daughter, she'll be writing the board exams, 12 board exams later this year. And she was also excited, she got the registration done herself. I'm finding, that when we ask kids to, take some sense of responsibility, they really, enjoy these things. But this apart, the point is very well that the vaccination is imperative. You are going to go to write the exams. The doctors have already explained the health benefits, and Ms. Nidhi has also explained the social benefits. So it is very imperative that the vaccination should be done. And the last 2 years, gradually in a graded effort exercise, vaccinations have been taking place throughout India, throughout the world. Let's take the case of India also. And I'm sure that there will be no house in this country who will have at least 1 or 2 members who have already been vaccinated. So I'm sure that any apprehensions regarding the vaccination, that is, there will be fever and there will be loss of immunity, I think those are all dispelled now. There's no apprehensions at the moment, and you will be rest assured, all the students, you will be able to prepare for your exams with a peace of mind, and you will be able to perform your best in the examination. That is what we require. So even though the CBSE has provided exams in 2 parts, that takes away a lot of burden, but still, you have to be on your best. So if you have been vaccinated, and that takes a lot of care about your mental issues, health issues, and you can prepare with your peace of mind and perform your best in writing the exams.
I must add over here, sir, that it would take off lots of burden from our shoulders and our heads too as parents and teachers. Because when we call them to school, it is we who are the most worried. We never give that expression. We have never been showing it, and we've been trying to be very bold. But I must tell you the kind of fear with which we have been coming to school every day. And end of the day, towards 8 o'clock, I would be waiting every day with my teachers to get a news that I hope everything has gone smooth and nobody's been contaminated throughout the day. So when you people come with all that vaccination, we would relax. So it's likewise, for our good and request that you do
likewise,
it.
I totally echo your sentiment. We are a residential campus, and we are always. I'm the COVID officer in the campus, nodal officer, and we are always under the apprehension that what's going to happen. There are kids staying in the hostels, even though they may be 18 years plus, they may be vaccinated, but there can be other type of issues. There are a lot of issues, lots of virus out there, and we have to be very careful. So at least, the first line of defense is there, the vaccination, Thank you. Yeah.
Absolutely, sir. Thank you so much for sharing a valuable insight with us. I would like to direct my next question to Dr. Kritika Chaturvedi. Ma'am, the vaccination for adults has been out and about for quite a long time. What is the basic point of difference between the vaccination that has now been developed for kids of the age group of 15 to 18 years and the vaccination that was previously being given to adults?
I think it is the same vaccine. Covaxin is only being given to children, right? And that was what was being given to adults previously. So they have only increased the trials to that age group, and then they decided that it was safe enough to administer the same vaccine to children.
Right, ma'am. Thank you so much. Dr. Sangamitra Ray, the next question is for you. Ma'am, is it imperative for children as well to get booster doses when they come out later, just like it was imperative for adults to get booster shots? Or is there a separate procedure that is to be followed for children and adults?
Okay, let me first tell you that the vaccine that you were asking in the previous question also, that the vaccine that has been authorized till date is that Covaxin right now, that is will be given to all the children 15 to 18 years of age group. And nowadays there are no recommendation per se that is constant. We are calling that living recommendations that are every day we are changing. As we are getting new evidence and the studies is prolonging for last 2 years. So when the study was done on Covaxin, the phase 2 trial had already included children 12 years above. They had already included, and this vaccine has been that is called emergency use authorization that has been given during this pandemic, seeing that what is the risk to this pediatric population. So I have a message for you, that just a message that is not for scaring you all, but as we have seen many children, that the acute infection was mild, but there was a separate entity that I don't think you must be knowing very well, is that of MIST, that is called multisystem inflammatory syndrome in children. And in that syndrome, that has presented almost 4 to 6 weeks after the child has got the acute infection. And in that scenario, we have seen the children really sick. They have there were involvement of brain, lungs, CNS, whatnot. This is not to scare you all, but this is just to say that it's not that children are not getting infections. It's not that the children are not getting severe infections. Yes, they are getting severe infections. So with vaccination, we can prevent this thing. And regarding the booster doses, there are some principles of vaccination is that the first dose that just stimulates your immunity. Second dose, that it gives a prolonged protection from the same organism, microorganism. It may be virus or bacteria or anything else. So booster is needed to just boost up your immunity, because after a certain extent, that antibody that develops, that wanes off. To maintain a critical value of these antibodies, depending on disease, the booster dose varies. So it may be in future we may be having some recommendation that the children will also need the booster dose. But as of now, we are giving only 2 doses to all the children 15 to 18 years of age group. And booster must be coming very soon.
I really hope by that time Covaxin is not required only, and this COVID thing goes off. अभी आप लोग बेटा सारे मिलके सिर्फ ये वाली लगवा लो, बाकी बाद में सोचेंगे. For the time being, the first step first. अभी तो we are hoping that we also don't need the booster after a month or so. All the best.
Right, ma'am. Thank you so much for your input. Now we also have members of the Queens Valley School Student Council present with us today, and I would like to direct a few questions to the council members. We have with us Gauri Tyagi, who has been a part of the children who have already received the vaccination. So I would like to ask her that were there any initial hesitations in your mind before getting the vaccine, and how did you overcome those particular hesitations?
Good afternoon, everyone. To be honest, I did not have any such hesitations because I've seen other people getting vaccinated and it was not a trouble for them. So I was quite comfortable all throughout the process. It was actually very good and it was comfortable.
Right. Thank you so much for sharing your experience with us, Gauri. We have another council member, Purva Solanki, who has already received her vaccination today. We would like to ask her to share her experience with those present in the webinar today. Purva, over to you.
Good afternoon, everyone. So, I got vaccinated today itself. So, first of all, I was very excited because after seeing all my adults around, they were vaccinated. So, I was very excited that I will also be vaccinated today. So the experience was quite well, though after 10 or 15 minutes I got a little dizziness and a little pain in my hand, but it was only for 10 to 15 minutes. Later it was not so, later I did not even get to know that I had got an injection or so, but it was a very nice experience overall. Thank you.
Thank you so much. We also have Shraddha Srivastav. I would like to ask you, as a student yourself, how would you make an effort to help convince your peers about getting vaccinated? Thank you so much for that well thought answer. We also have Afia Asif. I would like to ask you, Afia, why do you think it is necessary for students to get vaccinated at the earliest, taking on from all the opinions and advices from the panelists today?
I think Afia has been having network issues. So before we speak to Afia, I would now like to open the floor for questions from the audience members. In case there is someone who wishes to ask any of the panelists a question, kindly raise your hand so we may unmute you and you may ask your question. Right, Shraddha, you may ask your question from the panelists. Are there any panel members who would like to answer this question posed by Shraddha? Right.
Yeah. I would like to say that a fact, I'm just sharing a fact that the vaccine protects you almost 90% of the severe COVID infections, and it protects you against almost 65% of mild asymptomatic infections. That means it's not 100% protective, right? And what I mean by saying that mild infection is that even if you get a mild infection and you have some elderly or high risk group person at your home, they can have a severe infection. So what does that mean? It means that even after getting vaccination, you should have the COVID appropriate behaviors in place every time, everywhere, like putting mask properly, That is very important because everyone is putting mask, but proper application is very hard to see everywhere. So proper fixation of mask is very important. Hand washing is also important. Proper hand washing is very important. Okay. So, and social distancing. So these points we have to keep in mind for long duration of time, and we should make it a habit. We should make it a part of our lifestyle modification. I think that is most important. And this is the fact to back you up that this has a scientific validation to support this COVID appropriate behaviors. Thank you.
I would like to add a mother validation here. A motherly or a parently validation that whatever we do, the government has given you a jab, you get boosters also, you get everything. Immunity comes from inside, and that comes from your mother's food. So eat whatever your mother cooks for you and eat healthy, less of junk. I keep telling this again and again, your teachers have been saying, because see, until and unless you are strong from inside with your food and with your positivity, nothing else can work. So be happy, pray to God, be thankful that you have your parents around you, and eat good food. And everything else would automatically come in place.
Absolutely, ma'am.
I'm not preaching. Don't think that I'm preaching. All mothers keep saying this, but yes, that's the truth.
Right, ma'am. Thank you so much. Talking about a parent's perspective, I would like to ask Dr. Risham Garg. Sir, has your daughter received the vaccine? And could you tell us a little more about the experience behind it if she has already received the COVID-19 vaccine?
No, she has been registered but not yet received the vaccine. And in the next few days, maybe 2-3 days, the number will come. But yes, you know, as the earlier speakers have mentioned, I mean, the doctor has already mentioned, you know, the vaccine is the first line of defense, and the data says 90% immunity it will provide. However, you still need to have the COVID appropriate behavior. And as the principal madam has already mentioned, the diet is very essential, the immunity. So I would like to compliment you, madam. It's not only the mothers, but also the fathers who ensure that at the table, I always tell, you know, whenever
I rectified my words, sir. I said parents after that.
So at the food table, I ensure that whenever the food is cooked, it is hot, it is fresh, and whatever is cooked on the table, it should be consumed. So you should have a balanced diet. You know, you may like the junk food, but you must have a balanced diet. So immunity is you will have to have a diet plus some exercise regimen. You know, you will eat and you will do some exercise, physical activities that builds your body immunity, and that, you know, if you are active, physically active, the cold and cough will never trouble you, you know. So again, I'm sure the doctors would know better, but I see we do a lot of mental work, and there is a tendency of developing something, you know, there can be a weak sinus related aspects. Throat is sensitive, frequently susceptible to colds, and you know, so that is a great danger. You know, even I see nowadays in my neighborhood, kids, you know, who are maybe 10, 12, 14 years old, they are getting, you know, they are contracting COVID and other infections. So, you know, I mean, the doctors know better, but the initial thinking was that because the vaccines are already being provided since a young age, the kids already have a lot of immunity, and vaccinating to kids below 15 years might not be feasible. But still, you know, you have to have that COVID appropriate behavior and eat good diet, nutritious food, do whatever limited possible physical activity, and that is going to be the best line of defense. So yeah, that's probably what else limited in my limited understanding and in my experience over the last 2 years that I can ensure to you. You know, I regularly go for cycling every day, 20 to 25 kilometers in the morning. I mean, it's nice, you know, 1 hour, and it's great. Yeah, thanks.
Thank you so much, sir. especially for talking about your experience with the registration and also talking about the importance of balanced diet. Now that Afia is finally here, I would like to address a question to her. Taking on from all the things that the panelists and what Principal Nana said, why do you think it is so necessary for students to get vaccinated at the earliest?
All right, thank you so much, Reen, for the question. Now, when we talk about the importance of getting jabbed, especially keeping in perspective the vaccination for children, I would like to highlight that it is only inevitable that if the virus hasn't been contracted yet, sooner or later the children will be exposed to the virus. So better be safe than sorry. Apart from that, when a government is taking active initiative to mitigate the general public against the virus, then I think we should be rather receptive than being skeptical and doubtful about the credibility of the vaccine. And also, as it has been addressed by the intelligentsia present over here, that there are no such doubts regarding the credibility of the vaccine, why not go and get jabbed? Also, the children have been missing on a lot, and it poses a great threat towards the future of the country. And the children at large have been going through a lot, be it in their educational sense, be it in the emotional perspective. So I think it's only prudent to go and get jabbed when the opportunity is made available to them. Thank you.
Right, Afia, thank you so much for sharing your perspective with us. I myself plan to get vaccinated soon, and I hope the Student Council of QVS can continue motivating our peers and our school children to get the vaccine as soon as possible. Now, in case anyone has any more
here. This is in line with what Shraddha actually said. It's actually a very good idea for each one of us to at least pick up 10 people of our own age and continue this positive chain of motivating others, not just motivating others, but also ensuring that misinformation is not communicated and only something that is worth communicating and which is a positive information is transmitted from one to another. So if each one of us conveys it to 10 students and 10 students of the peer group that we know, and then the chain continues, I think we'll be able to ensure what we actually want to ensure. And this is actually a good way by which we can do it. And it does not even take in a lot of effort. So that's actually a very good idea. Thank you.
Right, ma'am. Thank you so much for your input. I would like to ask people who have questions to kindly raise their hands so that we can ask them to unmute, and you may ask your questions to the panelists.
At least the student councilman can make a promise to all of us that, yes, you will not let the chain break. Yes? Thank you.
I had a question for the medical professionals involved in the panel. There are children who are immunocompromised who already have problems with their immune system functioning. So in that case, how is the COVID vaccine beneficial to them, or is the COVID vaccine actually enough to give them the same level of protection that other people receive? If there is a medical professional who would like to answer the question, that would be great.
So let me answer the question. For any immunocompromised child or even adult, any infection occurs in the severe form, and prognosis is much worse than in a normal child. So even for COVID infection, if a normal child contracts COVID infection, it may be mild, like a common cold. But if same infection occurs in a child who is immunocompromised, like a child of cancer on chemotherapeutic drugs, child of chronic liver failure or chronic renal failure on dialysis, post-transplant patients, they get the severe form of infection, which may be life-threatening. So the vaccine manufacturer also recommends that all the children who are immunocompromised should get the vaccination. And there is a dictum that we should avoid live vaccines when the child is on severe immunosuppressive therapies. But this Covaxin is not a live vaccine. It is a killed, inactivated vaccine. So it will not cause active infection. The vaccine virus will not cause active infection in a immunocompromised child. So there is no fear of getting infection from that vaccine virus. It's not there. And this is highly recommended for immunosuppressed group also. And for case-to-case basis, you should discuss with the treating physician before taking this vaccine. if the child is on chemotherapeutic drugs or any other drugs. That should be discussed one-to-one case basis. But otherwise, in general, all the immunocompromised children should get this vaccination.
Thank you so much for your response, ma'am. I think Afia has a question. Afia, you can put forward your question now.
Thank you, Lavanya. So, apropos the discussion that we have had prior to this question answer session, I'd like to pose my question to Dr. Nitya, that anybody who has got their jab, how do they deal with the side effects, which are at their peak in the first 2 days?
Yes. So basically, these side effects generally will end up in 48 hours. Okay? It would end up in 48 hours. So if you're having like mild fever, and you can take paracetamol after vaccination, you can take it, right? And you don't have to worry about the pain, because it would also diminish within 2 days. But if suppose the fever is not going and the pain is increasing, then you might consult your doctor in that. And also, I would like to mention one point, that when you get vaccinated, the antibodies formation, it takes around 14 days. So within 2 weeks, it is possible that you can get COVID even after vaccination in the first 2 weeks. So you have to be precautious in that. So if the fever is not going, I would suggest you consult your doctor in that case. But otherwise, fever would generally last till 2 days, and you can take paracetamol in that case. That's it.
Thank you so much, ma'am.
Thank you so much for your response, ma'am. Are there any other questions that the audience would like to ask the panelists? All right, since we have no pending questions, I would now like to ask the panelists if they want to add anything to wind up the discussion, and if they want to contribute anything more to this discussion we've been having so far. Would any of the panelists like to add something? All right. Yes, ma'am. Ms. Nidhi Tyagi, ma'am, can you please unmute yourself?
Yes, I just want to make one request to all the students and the parents who are here. There is a responsibility that is lying with the government to give us the vaccination. Then there is a moral responsibility as a citizen of India to, get vaccinated and try as much as possible to get away from this COVID situation. So I really request all the parents and the kids to get vaccinated as soon as possible. And then the benefits of the being with your friends is an extra cherry on the cake.
Right, ma'am. Thank you so much for your input. Yes, Dr. Nitya Khare, you may go on.
I would also like to say that, people do say कि vaccine लगवा लिया, but it's not 100% effective. COVID तो तब भी हो सकता है, क्यों लगवाए? No, our immunity is strong, we'll not get severe infection. But please believe me, do get it. No, children, you all know that children generally get mild symptoms, but the post-sequelae symptoms now could be dangerous. The post-COVID illness, and as ma'am told, multi-system inflammation in children, that's very dangerous. So, it's much more beneficial to actually get that jab done, and don't avoid it for pain or fever, because, you have to assess the risk-benefit ratio. And you have to follow the 5 basic rules, that is wearing mask, washing your hands, respiratory etiquettes, ventilating your room, and avoiding unnecessary travel and social gatherings. So that is a must currently. And also one last point which I would like to add is that in this COVID pandemic, we have to take care of our health, definitely. But what we generally, I'm also a student, and you all also teenagers, what we have to take care is of our mental health. That is also very, very, very important. And you always talk with your friends. You don't have to take the social isolation literally. Be physically, socially isolated, but please keep talking with each other. That's really very necessary. Pursue your hobbies, and if you want to seek some professional help, don't hesitate at all. Consult psychiatrists. That's totally normal. So with that, I would like to end. Thank you.
Thank you so much, ma'am, for that wonderful insight. Dr. Isham Gayak, would you like to add something?
Sure. So I've seen, in the last 2 years, these young kids I mean, let's say that the kids who are older, they have taken a lot of responsibility. So they have tried to adopt the COVID appropriate behavior, and they also guide their younger siblings and in the societies the younger kids. And it's interesting and it's but natural. The younger kids look up and try to listen to their the elder kids rather than their parents. So it's a responsibility upon the elder kids also to develop and observe a COVID appropriate behavior and get the correct information. So you have the correct information and you can guide them. So that is what I have seen, and I've been seeing in the last 2 years amazing stuff being done by these kids who are slightly older. And I just wish you all the best, and I'm sure that your younger siblings and the younger generation is in safe hands. Yeah.
Thank you so much, sir, for your perspective. And with that, we now come to an end of our panel discussion. It was a wonderfully enriching time, and we would like to extend our heartfelt gratitude to all our panelists for taking time out from the busy schedules and for motivating and giving the right direction to the students and parents.
We would also like to thank the student and parent community of QVS for their overwhelming response. Thank you so much for joining.
Thank you so much. It was really a very nice discussion, and I feel very proud to be a part of this webinar. And so we should end this webinar in a very positive note that yes, we'll take the vaccine, we'll stay safe, and we'll help each other whenever needed. And if you need any help from me, do call me anytime. I'll be there as much as I can help you. And if you have time, 2 minutes, I have written a poem for my kid who is in class 2 of QVS, so I can share with you. It is called Quarantine. I am a kid, I know that, right? But I'm not afraid to show my might. If there's something I would fear one, it's only the harm caused to my dear ones. So if you ask me to quarantine, I would do, even if I like to play in the park, If you ask me to wash my hand, I would do that as you planned. If you ask me not to go out, I would obey that and would not shout. Because I know the days won't be the same. After this quarantine, I would again play those games. I would again be the naughty kid you knew. Till then, I would be a good girl, known to very few.
Wow, wow. I can assure you, ma'am, on behalf of all my queens, that they would not let this happen. They would never have to go for quarantine. They would get themselves the jab.
Yeah.
Yes, girls?
Yeah.
Yes. All the best. All the best. We'll all come out of it with real good colors and winning colors. Wonderful. Thank you, panel. Thank you so much. And thank you, girls. It was wonderfully planned and wonderfully done. I really hope that our message the aim with which we came, that message is conveyed to everybody and we all get that jab as soon as possible. Mr. Flack.
Right. Thank you so much once again to all our panelists and to our audience for joining us. Thank you, everyone.